Hi, I'm Paul Slofsky, physical therapist and owner of Rebound Physical Therapy. And today I wanted to give you some tips and tricks on how to relieve neck and head pain. You know, neck and head pain are very common conditions that we see in our PT practice. And I often use an analogy when it comes to balancing out what occurs commonly with head and neck pain. Okay, and the analogy I like to use is if whether it was a bowling ball on the end of the stick, or in this case I've got a mallet or a hammer, it could represent like a sledgehammer, if you will. But if this were a 10-pound ball on the end of a stick, which is obviously your neck, if your head was 10 pounds, which is an average weight of a head, 8 or 10 pounds, for every bit that goes forward, it puts an awful lot of strain on the muscles, on the joints and the ligaments in the head and neck area, and a lot of pressure down at the base of the neck into the upper back. So it actually, when you start going forward, it goes up to 4 times if someone just has a head that goes forward about 3 inches. So there's a lot of stress on the head and neck musculature or structures that surround it. It affects the muscular system, the nervous system, the circulatory system, and of course the integrity or the structure of the bones and the joints over time. So a lot of pathology can go into that. I'm not going to get into the specific conditions on this video, but I am going to tell you that all those structural elements have strain on them when you have a forward head posture. You know, rounded shoulders, forward head is the most common thing. Obviously, I'm excluding here right now traumatic injuries, playing contact sports, or being in a car accident or something like that, but just common everyday stress and strain from having a forward head posture, or working at a desk or doing repetitive motions and getting your body out of alignment or out of symmetry. When you have an unstable base, which your base actually starts when your feet hit the ground, but between the pelvis, the head, neck, and shoulders, and their alignment, whether you're sitting or standing, make a huge difference, because your base is important. The amount of mobility that you have, turning, bending the neck from side to side, of course, not just rotation, but back, forward and back motions too. But your ability to endure throughout the day, depending on the type of work you do or the positions that you're in, the strength or the intrinsic strength, because you have muscles very close to the spine, then you have the larger muscles that most people, get massaged or feel those knots or tension in. So there's a lot going on in the head and neck area that affect, like I said before, not just the structural integrity, but the circulation and the health of the muscle tissue and the joints. So how to relieve it? What are some simple things that people can do, before they even, embark upon a more aggressive treatment campaign in physical therapy? Relieving head and neck pain often, or most always, has a postural improvement element. I talked about symmetry before. That for us is usually number one. I recommend, rather than someone, telling someone to hold themselves in a stiff, upright posture, because everybody knows, okay, stand up straight or be upright. A simple trick is just to elongate the distance. If you have rounded shoulders, you probably have a rounded up or forward head and rounded shoulders. You probably have a rounded upper back as well, or maybe even low back. But just elongate the distance between your pubic bone, which is not in this scene here at the bottom of the pelvis, and the sternum, okay? The distance, keeping that and correcting that. If someone asked me a good exercise, I would say correcting yourself throughout the day, as opposed to just trying to, hold yourself in a military upright posture and squeeze your shoulder blades together. So that definitely puts my head and neck in a much different position, and takes the strain off of the head and neck muscles tremendously. So that's a simple repositioning thing, but there's also stretching that needs to be done of the muscles in all directions, forward and back, side to side, and then rotationally. Like I said, there's some deep muscles. Many times in PT treatment now, shifting into the treatment aspect of it, how we treat it at our clinic, beyond the postural improvement, manual therapy is very effective with head and neck type conditions to loosen up the joints that are stiff. And then meanwhile, we're strengthening the segments that might be a little less stable, not as a stable base, certainly doing postural strengthening, stretching or elongating tight muscles in the chest, and the head and neck area, while we're strengthening up those deeper muscles that tend to get weak right around the spine. They get a little lazy over time. You know, if a muscle gets too short, it gets weak. If it gets too long, it also gets weak. So there's an optimum range of motion that a muscle should move through. So getting you closer to normal. Look, you don't have to have perfect posture. You don't have to have normal muscles throughout. You have to move yourself towards your normal. And we're really good at that. We're really good at moving someone away from the current asymmetries they have and the imbalances they have in motion, in strength, in muscle integrity, and being able to know how to correct it yourself, which is what we do the most of, is a lot of education in these areas. Of course, the manual therapy is awesome, along with manual traction. Sometimes mechanical traction is used, and every once in a while we'll use some modalities for with heat or ice to calm the tissues down, because the muscles can get a little angry and very, very stiff, and lose their ability to create good circulation in and through the head and neck area, which obviously gives you the headaches too if you have circulatory disruption from chronic stiffness or spasm or tightness. So listen, we can help you with this. If you want to know more about treating your head and neck pain, give us a call. We'd love to help do an evaluation and get you on your road to success and get you feeling better again. So talk to you soon.